Good day guys, welcome to my channel. This is my second video. Today I'll be talking about elements of medical management. So that is to say that in your basic management plan, what should be your steps? At least 4 to 5 steps. One is screening. 2 is patient education, and 3 interventions. 4 screening of associated conditions. And maybe someone might argue that screening for associated conditions should be part of that first element there, screening. And 5, we could say it's a follow-up. Starting with screening, say a patient comes in, they're complaining of chest pain. The initial part of history taking, physical examination, and investigations that you order are really part of screening. So this will be perhaps secondary screening, so to speak. We can think of maybe primary screening, where we are looking for disease in an asymptomatic patient. I'm arguing that I could be wrong about this, but we'll come back in later videos to explore these other issues. And then patient education can take the form of explaining the condition. So explaining the condition. So for a patient who has chest pain, you might explain what's going on, what's the cause of the chest pain, and if it's appropriate, give them a handout on chest pains so they can go and read about it. And 2, you could also explain so interventions that you're going to deploy in this case. And 3, you can let them to say or educate them about the symptoms that they have. So it could be about symptoms or signs showing a deterioration of their condition, for example. So they're going downhill, so to speak, in their state. So say you are going to discharge them because you have reached sort of an inconclusive stage or an inconclusive assessment. You're not sure, but you still have a suspicion that the patient might go downhill. What might be the symptoms to to let the patient know that they would actually be an indication that they might be going downhill and therefore need to come back. With interventions, a few things. We could talk about lifestyle interventions. We could talk about medications or medical interventions. We could talk about surgical. And perhaps overlapping these 2, we could talk about procedures that need to be done for the patient. For example, a patient with chest pain, you might say, oh, you have high cholesterol, and therefore there might be some lifestyle things like exercise, diet, and so forth that would help to optimize their lipid profile. Or a patient with chest pain who's obviously having myocardial ischemia at that given time need to be taken to the hospital, where they might undergo a procedure of a coronary angiogram. So they go and have a coronary angiogram. And screening for associated conditions for a patient presenting with chest pain, for example, maybe it turns out that, yeah, they have some ischemic heart disease, and you might screen them for diabetes, you might screen them for kidney disease, or you might screen them for peripheral vascular disease if you think there's a need to look for those conditions. And follow-up may take the form of so we've had all these interventions. A patient with chest pains who turns out to have some ischemic disease have been seen by cardiologists, and they might suggest cardiac rehab. They might suggest some lifestyle changes as well, and there might be a need to see them again and have a reassessment to see how have they fared from the interventions that were given at the time of presentation, for example, just to touch base with the patient and see how they're doing. So that's what I will suggest as elements of medical management. You have to screen the patient, and the screening can take the form of physical examinations, history, physical examination, investigations, patient education, and so forth, giving out a handout to explain the conditions, the interventions that are going to be done, and maybe as a form of self-originating explanations of symptoms which may show deterioration of a condition, and therefore I need to present early. And then we can talk about interventions, and this will take the form of lifestyle factors that can be altered, if any, medical procedures, surgical procedures, and so forth. And then you can have screening of associated conditions, and then follow up to see how further to optimize a patient, optimization of lifestyle factors, and reassessment to see whether the interventions have worked for the patient. So that's it. Thank you for listening.